Hello, everyone. Welcome to another live episode talking about nothing but low carb. So, ito ay part pa rin ng ating celebration of the upcoming International Low Carb Awareness Week na magaganap this coming December 1 to 7. So, itatakol natin today would be low carb para sa may mga sakit and special conditions. I think a few weeks ago, we already tackled low carb for those na walang mga health concern, para sa mga generally healthy and mga young pa or kahit elderly or middle age, as long as wala pang sakit. How can you maximize low carb for better health, longevity, and prevention of illness? But today we will tackle iba't ibang uri ng applicability ng low carb depending on those conditions. So yesterday, I posted kung ano yung mga usual na gustong pag-usapan ng iba't ibang followers natin on how to do low carb. So I will read some of the questions. If ever wala dito, you can also try to put them in the comment section para ma mapag-usapan natin if ever makaya ng ating oras. So, hello everyone! Rose from Norway. Thank you so much for always watching. And of course, Ma'am Lori, maraming salamat for always being there. So, yung isang concern dito, not really directly related siguro sa sa mga may sakit. But meron siyang tinanong, what are the benefits we can derive using Himalayan salt? So, Himalayan salt, alam natin na it's one of the purest form of salt and marami siyang trace minerals and nutrients. However, yung kanyang minute na components of those mga mga kakaunting mga nutrients are actually hindi naman gano'n ka important talaga or gano'n kalaki yung impact niya when it comes to our health. The basic importance of Himalayan salt would still be the sodium chloride. Sodium chloride is just the main ingredient of any salt at all. But of course, since it's natural, hindi siya na-bleach kasi yung iba daw binibleach na para maging maputing-maputi. But any natural salt like sea salt, table salt, are actually equally good. Kasi yun naman yung pinaka-importante talaga sa atin. Especially when you are doing low carb. Kapag kayo ay naka-low carb, all the more na kailangan ninyong increase ang inyong salt intake. I think I made one video about that na yung isa sa pinaka-maling pwedeng gawin ng isang taong maglo-low carb ay mag-low carb at mag-low salt diet. Kasi all the more you are endangering yourself to dehydration of solutes sa iyong katawan. Yung dehydration, hindi lang po puro tubig lang. It can also be dehydration from electrolytes. You can even have greater risk of this, yung tinatawag nating dehydration from these electrolytes if panay, marami yung iyong water intake but without the necessary na electrolyte intake starting from sodium. So yung sodium is the most abundant na electrolyte sa ating extracellular fluid at ito ay madaling nawawala the moment you do low carb. And of course, with intermittent fasting, bumababa yung insulin level natin sa katawan. Kapag nangyayari yan, mas nagiging prone tayo to dehydration kasi ihi tayo ng ihi. So, hindi naman yan delikado. What you just need to do is to replace it. So, make sure that you are hydrating yourself well with water but with the necessary amount of electrolytes with the basic na sodium. Yung iba, natakot pa rin kumain ng asin, would actually be risking themselves hindi lang sa hyponatremia or pagbaba ng sodium kasi kapag ang sodium sa katawan natin ay bumagsak na at chronically mababa na, magiging at risk din tayo sa low in potassium, which is another question ng isang commentator here na kung ano yung pwede natin gawin when it comes to our potassium. Kasi yung potassium, kapag hindi na regulated yung sodium ninyo sa katawan or parating mababa yung inyong sodium intake or salt intake sa katawan, ay pwede ring itong mag-risk na magkaroon ng problem with your potassium regulation. Kapag meron ng hypokalemia or chronic na pagbaba ng potassium sa katawan, ay baka kailangan na talaga ng gamot or supplement to really give back yung mga nawala sa ating sa ating potassium stores. Kasi yung potassium natin is intracellular and yung atin namang sodium ay extracellular. So, dapat balanse sila. So, kapag bumababa yung iyong sodium, kapag hindi nyo ito naagapan, ay pwedeng i-match siya ng iyong potassium na nasa loob na inyong cells. So, parehas lang babagsak. Yung kaniyang common na findings would be, kung mababa ang iyong sodium, yung iyong mararamdaman would be weakness, pwede ring sakit ng ulo, headache, cravings, parating uhaw ng uhaw, or parating gutom, even if you're doing real low carb, kasi baka nakulangan na kayo ng sodium. At kapag chronically ay nakulangan na rin kayo ng potassium, magiging prone kayo to muscle cramps sa gabi, and pangangalay, minsan yung hindi ka, parang hindi gumagalaw yung tiyan, so constipation, and halos hindi rin kahit umuutot, kung pakikinggan niyo ng tiyan, yung borborygmi sounds or yung parang gurgling sounds na normally dapat ay nandyan, ay pwedeng mawala because of low potassium. So, very important yung enough potassium and enough sodium in the body. So, Himalayan salt is okay, and meron ka lang for the benefits, for the most important benefits of the Himalayan salt, you can just take any salt for that. But for us here, we also have Himalayan salt because it's pretty. Kasi kung puti lang yung salt, especially naglalagay kami parati sa plate namin, hindi makikita kasi puti rin yung plate. But Himalayan salt, nilalagyan pa namin kailangan ng pepper para makita. But with Himalayan salt, since it's pink, so nakikita siya. But otherwise, you can just have any other salt, the natural salt. Okay, so my question si Shirley, how about kidney? Pwede bang mag-carnivore? How it will affect the kidney? So this topic is actually will be discussed with Dr. Sean Baker. Siya yung pinakaunang doktor ata na nagpa-made famous ng carnivore diet. Yung kanyang schedule on ILCAO 2023 would be 6 p.m. ng December 1. So make sure na naka-log in kayo or naka-follow kayo sa ating other page, which would be the Low Carb and Fasting Org. So hanapin nyo lang yan in our Facebook, the Low Carb and Fasting Org, para makita ninyo kung ano yung sagot ni Dr. Sean Baker. This is one of the questions na sinagot niya kung pwede ba sa carnivore. But to give you a glimpse, yes, pwedeng mag-carnivore kahit pa meron ng kidney problem. Magkakaroon lang ng different na macronutrient proportions. So maybe you want to go on a more fatty kind of carnivore than just pure proteins. Okay? Eto, another, si Ma'am Bing Adana, yung kanya namang concern would be, sandali lang, may tumatawag. So, yung kanyang concern naman would be health and mobility of elderly. Kung elderly, na, kasi yung mom niya, 89 years old, she is still able to do basic chores, complaining not having, but yung problem niya is not having able to sleep good at night. So, in general, as we age, lumiliit talaga or kumukonte yung ating REM state. This is a part of our sleep wherein ito yung deep sleep level. And as we age nga, more likely, lumiliit siya. But what is important is kahit paputol-putol, but the accumulative number would still be enough. So, like Maming, yung ginagawa ni Maming, natutulog siya whenever she feels sleepy, nagkakaroon ng naps in the afternoon to make up for the lost sleep at night. But one thing that we note, we really practice is prioritize protein at night. Okay? So, sa gabi, you eat a little more proteins, pero hindi rin yung maraming-marami. So, yung example ko dyan would be kung yung protein allowance mo in a day is around 100 grams of protein. So, mga nasa 3 chicken breast yan. You can eat the 2 chicken breast during the day, and yung last na chicken breast, you can eat at night. And then, hindi rin maraming kasamang other foods. So, a lighter meal, yung gabi, better would be a lighter meal, pero protein-rich. Okay? I hope that is clear. Other practices would also be lessening your water intake at least 2 hours to 4 hours before bedtime para hindi ka magkaroon ng more chances of waking up in the middle of the night para umihi. Kasi the moment na ma-disrupt yung tulog mo, there can be a risk na baka mahirapan kang makatulog ulit. Okay? What else? So, yung isa sa pinaka-favorite tip natin on sleeping well at night would actually be what you will do during daytime. And ano yung pinaka-importante doon? Sun exposure, vitamin D. So, sun exposure would give you that effect na magkakaroon ng melatonin production in your body, in your mitochondria, that will actually regulate your circadian rhythm at night. So, pansinin ninyo, if you will have at least 15 minutes to 30 minutes of early morning sun, kung midday na, so maybe you can make it shorter. The more you have sun exposure during the day, the more you will have a good night's sleep at night. So I think we've tackled that in many of our videos as to how to improve sleep. Meron tayong 10 tips of sleep dyan. Hanapin nyo lang in our YouTube channel kung nahihirapan kayong maghanap in our Facebook channel. And maintaining health, so physical activity pa rin. And of course, positivity and mindset, no matter the age, importante, meron talagang will to live and reason to live. So always provide your parents, your grandparents, something to look forward to. Something na gusto nilang magising sa umaga always to do something. Huwag pigilan if meron silang mga gustong gawin. Kasi those are the little things that keep them going. And of course, provide them with happy and positive environment para mas ma-excite silang mabuhay every day. Okay? Because if not, kapag feeling nila ay wala na silang purpose, doon sila manghihina. So always provide them with purpose. At yun nga, kahit si Maming, sabi ko sa kanya, Ming, ang purpose mo lang is just to exist. Okay? Kahit mag-exist ka lang dyan, nakaupo ka lang dyan, tumatawa si Maming. Kahit pa nakaupo ka lang dyan, just you existing is already will already mean so much to us na nandyan ka lang, nakikita ka lang namin. And of course, nandyan si Engineer Andrew Key na parating tumatawag sa kanya. So, kailangan nandyan ka parating sumagot ng kanyang mga tawag. And so many other reasons. At kung gusto mo, like meeting friends, nandito si Chloe. So, yan, meeting friends na nag-meet sila. At yun, that's already a purpose in itself. So, always provide our beloved seniors the reason to keep waking up each day. Exercise, walking, as light as walking, lifting, kahit maliit na barbell lang or yung 1 liter or 2 liter na water, magsimula lang sa upper arm or mag-squats using body weight. Those little things can already do so much. Like yung isang coachy ata yun ni Kuya Gibo, no? Na 80 plus na from being bedridden ngayon ay nagwawalis na sa kanilang bakod. And those are victories already. Okay, so yan. So many things to do and it's not excuse na kung later age ka na ay hindi ka na pwedeng mag-change ng lifestyle. So what's good daw ay there's no expiration kung kailan ka gustong magpaka-healthy. So any na means and ways for you to be healthy, pwede mong gawin yan regardless of age. Okay? Si Mian nagtatanong about pregnancy. So another special condition would be pregnant women. And I think utang ko pa yan, no? I'm still due sa paggawa ng ating pregnancy na journey. But to give you a gist, generally, pareho pa rin yung kinakain namin. So mostly meat and ano ba yung rotate natin? Chicken, pork, for every 3 pork, may isang chicken at may isang beef siguro. Ganon, yung rotation. At for every week na puro meat, may mga isa o 2 araw na merong gulay. Yun lang. And then, may nagtanong din, how about if umiinom ba ako ng mga milk for pregnancy? Actually, hindi. Hindi ako nagme-milk. And it's even an advice by my obstetrician. So yung OB ko mismo, even not knowing that I do low carb, isa yon sa mga unang-unang advice niya. No need for milk. Especially na hindi pa alam kung sensitive ako to milk proteins. And when I had my food sensitivity test nga, nakita na true enough, I'm really sensitive to milk. So, the casein, I'm more sensitive to casein. Yung protein ng milk, dalawa yan, casein and whey. So, I am sensitive to casein. So, generally, hindi ko kailangan ng milk. So, yung kailangan lang naman ng milk is would be the calcium, di ba? So, nagka-calcium supplement na lang ako. Because if you will drink all of these milk just to get the calcium na needed, baka maparami yung sugar intake because a lot of the milk in the market ay puro loaded with sugar. Maybe nasa 40 to 50% is mostly sugar. So, sugar in the form of added sugar and in the form of lactose and galactose. So far, based on my ultrasound, yung growth ng fetus, kahit hindi ako nagmi-milk, normal pa din. So, that shows na hindi talaga siya ganon ka-essential. So, paano ko po makontrol ang aking blood sugar? Breastfeeding mom po ako. So for breastfeeding, I think this one was attested talaga by my sister and my sister-in-laws na kahit pa breastfeeding, they can have a lot of breast milk produced kahit naka-low carb sila. Yung essential lang ata would be hydration. Kailangan well hydrated ka. And then blood sugar naman, you always have to look at your sugar intake talaga and carb intake. So, carb intake, I think you can benefit from watching yung isang episode natin in International Low Carb Awareness Week wherein si Allison, a nurse practicing in the US and then managing patients ng diabetic, type 1 diabetic with who are pregnant, sila ang nagka-cater and the tips and tricks are on how to control your blood sugar even if you are diabetic, even if you're on insulin injection. So merong paraan and low carb can really do wonders kahit pa sa mga pregnant and breastfeeding women because majority of these sugar talaga na nagpa-spike ay galing lang sa ating pagkain. So the moment we improve our choices sa ating pagkain, most likely may improve din yan. Meron dito, low carbs 2 weeks na sa OMAD and 20 hours of fasting. Wow! Congrats, Junsky! And can you feel the difference? Di ba iba talaga kapag you feel lighter. Yung sa amin lang dito ngayon, kasi because I'm pregnant, hindi ako nagpa-fasting. So lahat kami dito hindi nagpa-fasting. Sabay lang silang kumain sa akin lahat. And yun, we also miss the time na nagpa-fasting kami because you really know you feel lighter, you feel more energetic. But there's a time for everything naman. What's nice is you already experience it and it will become a tool for you na kahit pa later on, you will no longer fast for some reasons, but you always know how to get back if ever. Okay? So, yan. Saan pa ba dito? Diet, maling nag-diet, basta maling way ng paglo-low carb at pagpa-IF, it can be delikado. Just like one case ata na nagkaroon ng diabetes ketoacidosis. So I don't think it's really real low carb because if it's real low carb, hindi ka mag-lead into diabetes ketoacidosis. Especially na when we practice low carb, what we promote now is low carb ka muna, wag mo nang i-force yung fasting, especially for those with health conditions. What we want is to lower first your inflammation in the body. And although ang pagpa-fasting ay nakaka-lower ng inflammation, but it can also induce stress sa katawan na baka hindi pa kayang i-overcome ng katawan mo. So slowly muna, and you can already do that by first eliminating yung mga pagkain that can lead into inflammation itself. So number one would be sugar and carbs na nakakapag-spike ng insulin. And the moment na pinababa nyo ito, slowly your body will have its inflammation level go down. So at least 2 weeks muna of clean low carb, hindi kailangan keto level na very high fats. Just cut down all the carbs and sugar and then eat more of the proteins and also essential fats, yung mga important and healthy natural fats natin until you become appetite corrected. Usually, if you will start with this method, na first 2 weeks, you can eat all the low carb foods that you want. And of course, no, always remember yung food list natin. You can get that from our website, JGR Tan MD food list na nasa website natin, or also in our books. Okay? Once you are already fat adapted, yung katawan mo, in 2 weeks time, masasanay na yung ginagamit na niyang energy would be coming from fats and hindi lang basta sa glucose or sugar. That's the time you will feel na mawawalan ka na ng ganang kumain either breakfast or dinner. You will actually naturally go into time restricted eating, TRE, or also known as IF or intermittent fasting. And when you are already in that state, so you enjoy it, makikita mo that you will already be satisfied with just one meal a day. But after a while of doing OMAD, baka magkaroon din ng time na kailangan mo nang mag 2 meals a day if you've already maximized your fat loss. And that's okay. Hindi kailangan isang routine lang sa inyong schedule ng IF all throughout. Okay? Always listen to your body. Just like one question that I encountered the other day with one of my patients in Rhino. Hello there! At sa kanyang mommy na si Ma'am Daphne na na-meet ko recently in our consultation. They ask how about fasting daw when it comes to menstrual period ng mga babae. So, in our practice, no, nakita natin na women have harder time fasting before their period. Marami silang mga cravings. So, during this time, make sure na you are maximizing your electrolyte intake. Salt, potassium if necessary, and if ever meron talagang craving, so give in. Eat. Hindi mo kailangan mag-fasting, pero eat low carb. That way, you will go through the process smoothly na hindi ka mahihirapan. Okay? So, we will look at it again. Hello po, Sister Mary, na 50 years old na. At ngayon ay nag-stick sa ating safe list. So, si Yan naman on procrastination, mental health, and food intake. So, this one is actually one of the topics ng ating ILCAW na International Low Carb Awareness Week with Dr. Sino nga yun, Ma? Yung ating speaker, si Dr. Edie? O si Dr. Georgia Edie, na isang psychiatrist practicing low carb. So, when you nourish daw, ano yan? Healthy food makes healthy mind. Parang ganun yung topic. So, this is really important what we feed our brain. Kasi sa mga merong mga health issues, mental issues, anxiety, depression, those are psychological, psychiatric conditions, no? But the food that you eat also plays a lot of role on how your mind mind works. So, very important to feed it with the right nutrients para mas maganda rin yung takbo. Just like yung makina, like a car, kung eto ay lalagyan mo ng hindi malinis na gasolina, eventually it will not function well. So dapat we need to nourish it with the right food, the right nutrients, and you should always remember na ang sugar is just a temporary fix na you would feel good, but afterwards it will leave. Ito ay mag-iiwan ng maraming toxins, ng maraming mga metabolites that will actually cause more problems to our brain. So, stay away from that kung gusto natin ma-improve. And of course, when you are already fat adapted, when you are already fueling on ketones, you will feel that you have this sobrang excess energy. You have this energy to do so many things. So hopefully yan, hindi ka na magpo-procrastinate. But of course, when it comes to procrastination naman, there are many other tips and tricks on how to do that. Maraming, you can read books about it. Books, I find books really helpful. And for the books naman, in case you're interested, na publish na yung ating book 3 sa ating, di ba meron yung book 1, Perfect at Last 12, Perfect at Last Weight. This one is for fasting, guide on fasting. The book 2 would be Perfect at Last Health, Eat to Heal. This one naman is to how to heal different health conditions using just fasting and low carb for healing. And lastly, Perfect at Last Wellness. So this one is for mental health, anxiety, and problems, or just generally for you to have a better view on how to deal with things in life para mas happy tayo. Okay? Si Sachi, may question siya for pregnancy. Mas higher daw yung kanyang triglycerides, but HDL is okay, VLDL is low, total cholesterol is normal din. So actually, may recent labs, yon tumaas din ng konti yung aking triglycerides, but my HDL is even higher. So this picture was similar to when I was doing dry fasting. So, kasi this one, I was on fasted state, kaya tumaas. There is this incidence kasi na yung triglycerides are the mobile, na mobilized na mga fats being used as energy. So there's just idea, there's explanation na kung ang triglycerides ay medyo mataas, as long as yung kanyang ratio is okay with when it comes to our HDL to triglycerides ratio, it wouldn't be a cause of worry because these triglycerides are being used. Yung hindi natin gusto na triglycerides are those triglycerides na hindi nagagamit. So on these things, when I was dry fasting, for 7 days yon. That's when I got my lab results na dun lang, first time na tumaas yung aking triglycerides. And that's because I am almost fully functioning or using fats as energy. So yon. And with pregnancy, especially kung naka-fasting like this one, I was on 12-hour fast lang naman. It's just little, but it's already being mobilized and it's explained by being already on the low carb or ketone way of functioning. So ketogenic na level of functioning, and I don't believe that it's damaging the baby because yung mga studies showing that ketones damage the babies are only sa mga animal studies. Walang studies on human subjects. So yun, but of course, make sure na all of your other parameters are normal. Consult with your obstetrician kasi baka merong other factors na hindi na consider. Okay? So always consult your doctor for all of this. And si Lolita, I want to hear those who were diagnosed of breast cancer. So kung meron dito na merong history of breast cancer, you may tell us your story. But for Mom Lolita, I think you want to follow also Dr. Fee Atencio, our very good friend, Doc Fee, who successfully combat breast cancer. So, yung last post niya, yung kanyang monitoring, thank God, no? Na clear lahat. Clear yung kanyang liver, yung kanyang lungs, and then yung kanyang bone. No sign of metastasis and no sign of new growth. And we really believe that a good nutrition plays a lot of role in healing and at the same time prevention ng illness because for number one, okay, cancers feed on sugar. So kahit yun lang, okay? Ang cancer po, yung primary na pagkain nila would be carbohydrates, would be sugar. And it can be from glucose, it can be from fructose, it can be from starches, okay? Rice, patatas, too much fruits na mataas sa fructose can still feed cancer cells. That's why I don't believe a fruitarian diet can do well sa cancer patients because we have a personal experience like yung papa namin who have been eating guyabano, mangustin, at kung ano-ano pang mga fruits na sinabing tama daw sa cancer. This was before we learned about low carb and fasting, but eventually he still died of liver cancer. So, yon. And our other families din, hindi tatlong tita ko na mga payat. They're all very petite, but all died of pancreatic cancer. And we know pancreas is one of the organ na overwork talaga when you are over-consuming glucose and sugar. And these aunts of mine, ay lumaki sa sugar capital of the Philippines. So the work that they do always deal with sugarcane and sugar production. And as usual, yung usual na kinakain, all carbs, rice, may soft drinks every meal time, yung breakfast at yung mga almusal and snacks would be bread or turon, kamote, very very high carb. So no wonder it led to that, and hindi sila mataba. They are actually very petite, maliliit yung kanilang physique. So all the more if you are not a fat former, all the more you should be very careful if you are prone to overeating glucose and carbs, kasi you will question kung saan napupunta yung effect na yun. Okay? And may nagtanong din about hypertension, 100/64, mababa daw masyado. Actually, it's very normal. Si Maming during her operation last week, yung BP niya 96/69. Yung kanyang heart rate 66. So yun lang the whole time. So I have seen more patients na way younger, 20s, 30s, na nag-fluctuate yung kanilang BP at 130, at 140. Pero si Maming, never kami nagka-problem. Yung kaniyang monitoring very very steady and stable. Kahit yung ninang Millet, the anesthesiologist who took care of Maming. Thank you so much po, Doc, and Dr. Alzate for the cardiopulmonary clearance. Maraming salamat. Hindi sila nagkaroon ng worry because her vital signs and her lab results are that of a way younger, parang patient na in middle age or teens or young, very young talaga. So, ano pa ba? Saan pa dito yung mga gusto nating high creatinine result in LCIF? So, it's one thing also that we talk about kasi na-record na natin yung session natin with Dr. Sean Baker, no? So, please watch out for that. He actually said na hindi creatinine ang best way to look at our kidney function kapag tayo ay naka-low carb. There is an even better gauge. So, hindi ko muna yan sasabihin so that panoorin ninyo ang International Low Carb Awareness Week. Make sure that you are following our Low Carb and Fasting org na page in our Facebook channel, and you can also watch it in our YouTube channel and also in our Twitter account and in our website na Low Carb and Fasting org. Okay? Kasi hindi lahat na tumataas yung creatinine doing low carb ay nasisira ang kidney. It doesn't work that way. So know more about that as we tackle that together with Dr. Sean Baker. Okay? So hello, Ma'am Kay. Namiss na natin yung kombucha ni Ma'am Kay Ming, no? Hindi na siya gumagawa siguro. So, yan, practicing fasting since however, I'm not comfortable sa bilbil, banda ng puson after manganak. So, give yourself at least 6 months na pwede kang mas bigger than your pre-pregnancy state. Okay lang yan, but after 6 months, you should be already somewhat nearing your pre-pregnancy weight. And if not, of course, exercise helps. So, importante pa rin yan. Okay? Normal cholesterol in low carb. So, we have discussed this already na hindi lang yung total cholesterol yung ating titingnan. And if you are really concerned na tumataas yung cholesterol and LDL mo, you can get your calcium scoring, okay? Your CAC scan. Kasi maraming low carber na kahit pa sobrang taas na kanilang LDL and total cholesterol, but their CAC scan is actually at zero yung risk nila of heart attack and stroke, and that is a better gauge when it comes to cardio health. Okay? Na huwag tayong papaloko lang na dahil mataas yung LDL natin. Make sure lang that your triglycerides, VLDL are low and HDL is normal or higher than normal. Okay? So, saan pa ba? 2 pieces of egg daily. Natatakot ba? Kasi nakakapagpataas din ng cholesterol. First, cholesterol is actually not bad. It is important for our cellular repair, for our immunity, for normal functioning ng ating pangangatawan. It's even food for our brain. So, wag matakot sa cholesterol. As long as, again, no, the other markers of inflammation are low or within normal range. Walang inflammatory markers. And yung meron tayong isang lecturer on International Low Carb Awareness Week, Dr. Mary Newport. She is a pediatrician na neonatologist. So, yung mga in charge sa ICU sa mga baby. Yun. Siya si Dr. Mary Newport, and she's also an author, an advocate of ketogenic diet, and uses coconut oil to treat Alzheimer's disease. And in her lecture na binigay niya during the International Coconut Congress, na kung saan ako pumunta last month in Jakarta. Last month ba yun, ma? Just this month. In Jakarta, ay i-share namin yan on International Low Carb Awareness Week. At doon niya nakita isang research kung saan nanggaling yung takot ng mga tao sa itlog. Because there is this research na yung mga subjects nila, pinakain nila ng 5-6 na itlog per day at nagkaroon sila ng cholesterol plaque sa kanilang ugat. Pero alam niyo ba kung ano yung mga subjects? Hindi tao, kundi mga rabbits. Of course, the rabbits are not adapted to eggs because that is not their natural food. Rabbits in general are vegetarian. That is why hindi nila metabolically ma-process yung high cholesterol and protein in the egg. But for us humans, tayo ay built to process proteins and fats. We've been eating that for centuries, for millions of years. Kaya hindi applicable yung result ng mga rabbits na yon sa atin. And we now see changes sa guidelines na tinanggal na nila ang cap or yung limit on amount of cholesterol intake because for so many years nakita nila based on scientific studies na wala talagang direct correlation ang amount of dietary cholesterol to the cholesterol plaques na nasa ating katawan. In fact, Dr. Mary Newport said there are even newborn babies na pag panganak pa lang ay meron ng cholesterol plaque meron ng atherosclerosis sa kanilang aorta. And that is something na hindi mo masasabing galing sa diet because the baby are still being fed from the mother at wala pang dietary food intake of their own. And yun nga, walang study specific saying that eating more than 1 egg, 2 eggs, or 3 eggs a day will actually lead to any heart problem. Okay? So ano pa? Gallbladder stones and low carb. So, ang gallbladder stone, hindi siya directly related to just fat intake. It's still about inflammation sa katawan, and also the moment you do zero fat, low fat diet, all the more you will be more prone to gallbladder stone formation because of stasis or ano yung stasis? Stasis is when there's no movement, walang movement sa inyong bile. At kapag walang movement sa inyong bile, so all the more magkakaroon siya ng tendency to have that stone formation. Ang example na study dyan would be those who were on restricted diet na mga obese, tapos bigla silang pina-low fat diet na wala silang kinaing fats. Ang incidence ng gallbladder stone formation sa kanila ay sobrang taas, very significant. Because yung bile o yung apdo na nasa loob ng ating gallbladder will actually be moved and replenished as we eat fats. Kaya siya nagkakaroon ng turnover. But of course, the worst kind of diet that you will do is high fat and high carb intake. Okay? So, dalawa yung posibleng magka-lead into gallbladder stone, high carb, high fat, or high carb alone with lots of inflammation na very low fat diet. So that can also lead into gallbladder stone formation. And depending on the size, maraming patients na nagkaroon ng pangliit ng kanilang gallbladder to a point na they were able to pass it out naturally kahit hindi na operahan. But meron ding iba na kailangan talagang operahan like Maming and my sister. So si Maming yung kanya isang malaking buong gallbladder, whereas my sister naman is maraming maliliit na maliliit. So it happened after years of low carb at biglang nag-high carb. So, yun. For the longest time na naka-low carb, wala nang sakit. Hindi parang halos wala na dyan. But merong mga moments of weakness and moments of, holiday. I think Christmas yun, no? You were in the hospital, Christmas ba, Ming? Or Christmas Eve. Oh, so Christmas na hospital si Maming and nag-undergo ng cholecystectomy. Kasi binigyan siya ng chocolate cake ng aming pinakamamahal na tita at eto ay kinain din niya. So yon, so that was already 3 years ago na. Magda 3 years na, no? 2020, 21, 22, 23. So magda 3 years na yon. And also, my sister also underwent elective cholecystectomy. Nag-elective lang naman yung sa kanya. So yon. But there are many others na successful na nawala yung kanilang gallbladder stone. And while we are talking about stone, even if it's a different stone, meron ding mga testimonials on improvement of their kidney stones. Pero yung iba, nakakatakot lang, Ming. Kasi nag-fasting sila. And then, bigla silang nagising in the middle of the night na sobrang sakit. They were able to pass it out. Pero sobrang sakit, especially lalaki na dumugo, pero lumabas yung stone. Grabe talaga. Sobrang grabe yung cleansing ng kidneys. But ako, if I have a choice, no, ayoko experience yun. Pwede mo namang ipatanggal surgically or non-surgically. Meron namang mga shockwave, merong iba't ibang non-surgical procedures for it to be passed out. Meron lang certain sizes, kaya kailangan ikonsulta ninyo ang inyong surgeon. So, urologist for your kidney stones and ano ba yung sa gallbladder? So, hepatobiliary. So, hepatobiliary na subspecialist. Ang dami natin pag-usapan, na pagod na ba kayo? Gusto na ba natin, ano natin yan? Doc, paano po pag nagda-diarrhea? Normal lang ba pag low carb? 16 days ng low carb today and 1 week watery poops. So, look at your food intake. Kailan ka nagda-diarrhea, Ming? Ano kaya? Try to look at your food intake. Kung kaya mong mag-try mag-carnivore muna, kasi yung carnivore talaga would be one of the safest food. Try to eliminate muna others. Okay? Focus muna on meat. So, chicken, pork, beef, fish, eggs. So, yon. Yun lang muna ang kakainin mo. And then, kung wala ka ng diarrhea, try to add in kung ano yung usual mong kinakain. Kasi minsan, baka napasobrahan ka ng mga plants that can irritate your gut or baka, kanino ba? Sobra na, ano ba yung common? Yung kay maming kanina, raw na gata naman na parami. Paraming raw na gata. So, yon, that can also lead into diarrhea for some, depending on your tolerance. But when it comes to food elimination, try to eliminate first all the plants within our safe list. Of course, no, kailangan muna make sure na kinakain mo nasa safe list natin. Baka kasi low carb na bago pa, pero baka puro mga goodies and mga pagkain na sweetened with sugar alternatives, because even if they are generally low carb, pero those with erythritol can actually lead into flatulence and loose bowel movement. So, like my husband, hindi siya makatolerate ng any sweetener. So, basta merong sweetener, nagkakaroon siya ng loose watery stool. So, try to have a 24-hour food recall kung ano yung kinakain mo. Okay? And hopefully na makita mo yan. So, do a food elimination process. Eliminate first all the ones in the danger list and then caution list. And then kapag nasa safe list ka na at nagda-diarrhea ka pa din, try to look at your plant intake. So, eliminate mo muna yan. Try to focus muna on the meat. I'm sure, kahit meron ka pang restrictions on the meat, you'll always have that option. Walang taong allergic sa lahat at wala pa akong kilalang allergic sa beef or allergic sa pork. Allergic sa chicken, meron. Allergic sa seafood, meron. But generally, pork, beef, walang allergic doon. It's just a matter of preference or religious restriction. So, nasa sayo yan. And the moment that you can already have that known safe na kinakain na hindi ka nagda-diarrhea, try to add in kung ano yung usual mong kinakain. Like say, for example, sayote or cucumber. And then pakonti-konti until malaman mo kung saan ka nagkakaroon ng loose bowel movement. But those are all signs of gut irritation. So, sa ating experience, plant toxins, plant antitoxins have the most potent na gut irritation, including mga nuts and seeds. Okay? So, Severe eczema. So, meron ding severe eczema. Severe eczema is related to our autoimmune problem. So, isa actually siya sa mga pinaka-benefit with carnivore way of eating. So, safe carnivore, wag marami yung mga barbecue sauce or kung ano-anong marinade. Just plain salt and pepper. Although yung paborito namin ngayon, salt, pepper, and coriander powder. So, yun lang. Or just salt alone. You can already have the most sumptuous carnivore meal ever. So, meat, beef, pork, sobrang sarap na. You can do a trial of 1 week at makikita mo the flare up on your eczema ay magda-die down talaga. But of course, if you meron talagang current na flare, maybe you can have some steroid na topical lang. Okay? Topical steroid can already help. Try to avoid steroid na oral because it's systemic. Makakapagpa-down siya ng immune system if it's chronically taken. So, dapat kung nag-advise man ako ng steroids before on my patients, it's just no more than 3 days or 1 week pero tapering dose na yon. Ibig sabihin, first 2 days, yun yung normal and then after the remaining 3 to 4 days, pababa na until wala na silang iinumin. Okay? May high blood po. And with 3-month-old baby, so hypertension is still related to inflammation and not actually directly related to salt intake or fat intake or red meat intake. Okay? It's mostly still of inflammation at malaking bagay yung increasing natin na sugar and carb intake. I've talked to one of my tita nga and kahit hindi pa sila strict low carb sa kanilang family, but the moment na ni-reduce nila yung kanilang carb intake, less rice, less sweets, ay sobrang grabe na yung kanilang health improvements. Yung mga allergies ng mga cousin ko, yung mga visits nila sa ER, yung mga common colds and flu ay nawala na even if they are not very strict in low carb. So how much more if you will do a clean low carb way of eating? And of course, these questions and these concerns sa may mga sakit, it's best if you will study it the more structured way as exemplified no and emphasized with ni Mommy Ruth who is one of our speakers sa mga seniors dyan. Yung kanyang topic po would be low carb for senior citizens and she's a senior citizen living in the USA, living alone at the age of 73 and taking care pa of her apo during the weekend. So, tuturuan niya kayo how to do low carb the right way and she will tell you talaga how important it is to learn low carb the structured way. That's why meron tayong LCF Masterclass by yours truly. Meron tayong mga official pages that caters Facebook enrollees. Okay, so nandyan yung LCF Masterclass by yours truly, Engineer Andrew Key, Masterclass by yours truly, and Health and Wellness by Coach Alvin. So if you need enrollment sa ating Facebook na Masterclass, you can course it through those 4 pages. Ida-direct kayo namin if ever you will contact us through our page. But of course, for our YouTube channel and Twitter na hindi naman naka-Facebook, so you can just enroll sa ating lcfmasterclass.org directly online. So I think all of those things no na mga concern, heart disease, osteoporosis are all already tackled sa ating master classes. Okay? Merong nagtanong, gusto ko bumili ng noodles but I'm hesitant kasi baka fake one at scammers. How to know if the noodles you are promoting is from you? So, Sir Tom Jones, wala po akong pinopromote na noodles. So, lahat ng yan ay scam. So, yan. So, dapat sa lahat ng nakabili na or may planong bumili, ay wag na kayong bumili. The only one that I'm endorsing right now would be Chapes. And one of our staple namin, especially when I go out, would be, yan, yung keto bites natin because it's very handy and mas madaling hindi madapa, especially if you're going to gatherings or meeting people, tapos kumakain, tapos yun, madali lang kasi mag-low carb kapag kumakain sa labas because you can just eat the ulam. Pero the moment na dessert time na at wala kang makakain, baka ikaw ay mapasubo at makakain ng kung ano-anong high carb dyan. So might as well have keto bites in handy. So yun lang yung aking ini-endorse for now. This is also my favorite product of Chapes na nasa billboard natin last time in EDSA. So, yon. And so, all the noodles, ano pa yon? Ano pa nakita ko lately? Purple, ano yun? Charcoal toothpaste, veggie noodles, ano ba? Barley, and kung ano-ano pa. So, sobrang dami yan. So, don't buy anything there. Usually, hindi yan essential lahat, especially if you will just stick to the safe list of J. Jordan and the food list na lahat ng mga pagkain dyan, it's either you can cook your own or you can buy sa wet market or sa fresh produce section ng grocery. Okay? So, I'm just happy na nandiyan na si Chapes kasi hindi na ako kailangan magluto at mag-prepare ng mga ano yan, mga emergency desserts if kailangan nating mag-dessert kapag tayo ay nasa gathering, especially this coming holiday and Christmas season. So, fear ng ibang diabetics on DKA. So, yon. I already made a video about that, no? Na yung diabetes ketoacidosis, when you are doing low carb the right way, hindi siya mangyayari. Simple fact. Diabetes ketoacidosis, mataas na ketones, mataas na glucose. Kapag ikaw ay naka-low carb, yes, mataas yung ketones mo, pero yung glucose mo ay mababa or normal lang. And that is what we call nutritional ketosis. Okay? So it's a therapeutic level of ketosis na nakikita na maraming health benefits including Alzheimer's disease, dementia, and even pag-shrink ng brain tumors. Okay? And last na, can we heal melanoma by fasting and low carb as well? Tsaka leukemia. So melanoma and leukemia are type of cancers. And as usual, sinasabi natin na ang cancer, regardless of kind, feeds on sugar. So we cannot promise talaga na mahihil ito ng low carb. But we have a lot of testimonials na nag-improve ito, nag-heal. But it doesn't mean na hindi na kayo mag-undergo ng treatment. If the standard regimen now for that kind of cancer would be radiation or chemotherapy or surgery, I still promote doing those kung kailangan talaga, kung necessary. And based on studies, to those who are doing low carb or even ketogenic diet and naka-cancer patient will respond well. Mas maganda yung kanilang response sa chemotherapy and radiation as compared sa nagki-chemo-radiation, nagki-chemotherapy na hindi naka-low carb. Their tolerance sa procedure, the presence of pain is way less as compared sa mga naka-high carb. So there's no disadvantage if you will do low carb and you will go on these standard treatments talaga. Okay? At the very minimum, at least when you do low carb, hindi mo papakainin at pablalakihin yung mga cancer cells. Okay? It might remain the same, but at least hindi na siya lalaki pa. But of course, we will hope, we will pray our very best na sana ito ay lumiit or magkaroon ng remission. So, I think that's it. Mag-1 hour na tayo. Oral glutathione habang nag-IF. So, better take it. Kung nag-glutathione kayo, better take it kung kayo ay nasa eating window na. Because the best benefits of intermittent fasting is when you are fasting clean. So, what do we mean when you are fasting clean? Clean fasting, either water lang and electrolytes, or none at all, especially if it's just 12 hours, 16 hours of fasting. Baka kaya lang naman mag-dry fasting and then increase your fluid intake and electrolyte intake starting 14 or 16 hours on your fasting time. Okay? So maraming salamat pa. I think yan lang, no? Collagen for diabetic, okay lang naman. Kailan Shapes sa Cebu City? I think kailangan nyo mag-franchise ng Shapes. Okay? Saan bumibili ng chips? Wala akong bumibili. Chips yun. So, chips. So, chips, keto cakes. Meron silang online, I think. At meron na rin silang maraming branches. So, congratulations, chips, for your opening of another branch. Okay? Sciatica, ankylosing spondylitis. So, these are all related to inflammation din. So, kahit pa nga, meron nga isang follower before na meron ng slip disc na scheduled na sana for operation. But doing low carb, it improved na hindi na kailangan ng operasyon. Okay? Pag tumaas, mataas ang sugar, 586, ano, pwede ipakain, hospital po, pero nakalabas na po. This is actually one of those emergency cases na delikado talaga. So it needs to have constant monitoring. Make sure na ang constant monitoring natin for those with diabetes like this would be monitor sa umaga, pagising, monitor before kumain, monitor after pagkain. So, kung 3 beses kang kumain sa isang araw, so 6 na beses ka at minimum para malaman mo kung yung kinakain mo ay true low carb or not really low carb. So, these are all outlined in our LCF Masterclass na hopefully you can study on your own para mas mag-guide kayo kung paano ito gawin. Okay? So, di mag-rice pero habang nagtuturo po, so super hina ako. So usually, it's all or nothing yan eh. Kapag konti-konti yung rice mo, pero may kumakain ka pa rin ng tinapay, ng crackers, or kulang yung kinakain mong ulam, kulang yung nilalagay mong salt, manghihina ka talaga. But no rice, pero dodoblehin mo or triplihin mo yung ulam mo, enough amount of salt, minimum of 1 teaspoon a day, I doubt if kayo ay manghihina. Okay, try to do that. Try to do low carb the right way. I think I made a video about the 2023 guide sa pagsisimula ng low carb and intermittent fasting. You can watch that in our YouTube channel para mas mag-guide kayo. I'm sure hindi kayo manghihina. Nanghina ka ba, Ming, ever sa low carb? Never. Si Maming ay nagiging sleepy lang, but hindi siya busog, but hindi siya nanghihina. Okay? And also, same way with uric acid, merong ibang mga low carber na tumataas yung uric acid, pero compared to high carb sila na mataas yung uric acid, merong mga aches and pains. So, it's a matter, again, of inflammation plus uric acid. So, we always blame the other thing. So, ano yan? Pagtaas ng cholesterol, pag heart attack, mataas na cholesterol and inflammation. But actually, it's really the inflammation that will have the more problem. Pagkakaroon ng gout, pagkakaroon ng gout related to uric acid, but it's actually more on the inflammation, not just the uric acid. Okay? Same thing with our fatty liver and gallbladder stones. It's not just about the fat intake, but it's also the inflammation that comes with it together dahil sa mataas na carbohydrate intake, specifically glucose and fructose. Okay? So I hope you learned something today na sa ngayon kapag merong mga sakit, parang madaling sagot, no? I-low carb mo lang yan. But of course, we understand marami ring other factors. So we are not saying na low carb is the answer to everything, but it could be the answer to so many things. Yun na lang. Merong allowance. Plus, of course, positivity, faith, discipline, consistency, huwag magmadali, be patient, and realize na everything is a process, but you have to believe that you are on your way to healing. So yun lamang. I'll see you again next time on our video for International Low Carb Awareness Week, December 1 to 7. Magkakaroon tayo ng series of videos and lectures to promote international low carb awareness all over the world. So yun lang po. Maraming salamat. I'll see you again next time. Remember to always stay low carb so that we all stay safe. Thank you. Have a good night, everyone.